Hey everybody, welcome to this week's PermanenteDocs Chat. I'm Dr. McDonald. Tomorrow is Earth Day, and this week we'll be discussing how physicians can support the environment and climate and health and how it's all related. I'm really excited for our guest, Dr. Irwin from the Northwest Permanente, who co-led a program at their organization called Wait, Don't Waste. Like wait, don't waste, and addressing surgical waste in particular too. So thank you all so much for joining. If you have questions, anything you want us to specifically chat about, feel free to drop them in the Q&A box, or if you're streaming on Facebook Live, just drop them in the chat there, and we'll try to get to them as we go. So we're going to keep these short, high yield, about 20 minutes or so. So we're going to jump right in. So first off, Dr. Irwin, thank you so much for joining us. Start by telling us who you are and what you do.
Yeah, you bet. Thank you for having me. So I'm Dr. Sandy Irwin. I am a head and neck surgeon, and I've been with the Northwest Permanente Medical Group for about 21 years now, so a long time. And I do a lot of regional work with Northwest Permanente around product use and optimization, but I'm also the vice chair of our National Product Council, sponsored by the Permanente Federation. The work that the National Product Council does is quite broad, but the main thrust is to provide clinical oversight for quality in the products that we purchase and use for our members. So from a national standpoint, National Product Council, and from a Northwest Permanente standpoint, I also am the co-chair of our Regional Product Council. I am a working member of our SPOT team that you referenced, Alex, which is our surgical product optimization team. And as in my leadership role with the National Product Council, I also sponsor and help to drive our National Product Use Lifecycle initiative. And product use lifecycle includes what happens to products after they're used.
Great. Awesome. I'm really excited. One thing I can tell you, especially for the past 18 months, when I've been going in and out of COVID positive patients' room in the hospital, the amount of medical waste and the gowns and the gloves, and every time I do it, it kills me a little bit inside because I know it's all just going to the garbage. Anyway, so we'll get more into that later. Yep. But tell us more about kind of how you got involved in this work and your background and how that relationship between products and medical waste and the climate and health and how you kind of got to where you are at this point.
Yeah. So in the 21 years that I've been with our medical group, I have filled a lot of different roles. And as I look back and reflected on them for this conversation today, I realized that a lot of the work that I have been involved with has really been about stewardship. And it started with OR utilization. I led the OR utilization effort in the Northwest for a while. And then I became a member of one of the working teams under the National Product Council, so one of the sourcing and standards teams for head and neck surgery. And in doing that work, as we would sit in our team and we would talk about the products that we're looking at to provide for the organization, one aspect of the conversation was always about the environmental impact of the choices we were making. And in the early days, back 2006-ish, it was just a conversation because we're all interested. But over the ensuing decade and a half, those conversations have become a lot more formal, and the environmental impact of our products actually has become a required significant factor in contract decisions. So in reflecting on those conversations, what I learned as a member of that team was that it was always a push and pull conversation. There's this balance. We want to recycle, we want to reprocess, we want to do the right thing, but at the same time, we have to consider cost, value to the patient, quality of care to the patient, and the other resources that are involved in doing that recycling and pre-processing. So, for example, when we were sourcing for gowns, gloves, drapes, specifically disposable gowns and disposable drapes, the question came up, why don't we use reusable drapes. Remember those days when we used cloth? It seems like such a waste to throw every single one of those gowns away. You die a little bit inside each time, like you said, Alex, right? Yep. And so, but when you look at that and you start looking at what it takes to wash, reprocess, reusable cloth, then you start looking at regions like the Californias where there is a massive drought and water shortage, and you run into the environmental impact of the amount of water it takes to do that work. So it's always a balance. And those discussions are one of the vibrant parts of that product sourcing work that has always appealed to me. And the thing I've always noticed about it is we have a lot of physicians in those conversations who care deeply. And that speaks to, what our role is in the environmental impact that our healthcare organization has.
Yeah, that's so interesting too, and it's something that I didn't really know much about, honestly, until one of my colleagues, who's actually one of our environmental champions here at Kaiser Permanente in Fontana, was talking about the paper towel dispensers. All the paper towel dispensers in our organization, in our hospital, are battery operated. They're not plugged into the wall; they're actually battery operated, and those batteries die every couple of days, and just the amount of battery. Right. And the amount of batteries we go through, and where do they go? And not to mention just the paper used to wash the hands versus like the air dryers for hand hygiene and things like that. Anyway, but there's all these myriad of downstream effects, which a lot of people don't even think about and aren't even aware of. So anyway, that's part of the reason I'm so excited to have this conversation with you and get this information and get the awareness to a broader audience as well too. So tell us more specifically about the Wait Don't Waste program, and I think SPOT's surgical.
Yeah. So in the Northwest, our particular flavor of this is called SPOT, SPOT, Surgical Product Optimization Team, and there are a lot of components to product optimization. The environmental piece of it is a large part of that, but it's not the only part of it. So Wait Don't Waste is an effort that exists under the SPOT umbrella. And what it has to do with is, I'm going to back up for just a second, because when it comes to environmental impact and emissions and waste, there are a number of aspects. There is, what potential harmful or rare high impact raw materials go into the products. What is the effluent of the manufacturing process, the emissions created, the water runoff created by the manufacturing process? There's the environmental impact of transportation. There is the packaging. There's the storage of the goods. All of these things have an environmental footprint. And then there's the disposal piece. And that's the piece that we have a lot of visibility to when we're standing outside that patient room, changing our gown for the 8th time in the last hour, right? And so when we talk about Wait Don't Waste, there's that giant footprint of all the scopes of waste. Wait Don't Waste is really about the part of what goes into the trash unused. Okay. And the reason that that's impactful to the physicians, and the physicians and clinicians have a large role to play, is because we all, I think, are pretty aware that healthcare is a huge chunk of the percentage of environmental waste and emissions in our country. Within that healthcare umbrella, the OR is about 60%, 60 to 70% of where the vast majority of our medical waste gets generated. And physicians have to recognize that their choices and their actions, especially in the operating room, play a huge role in driving how the products get used and how they don't get used. Okay. So I focused at the beginning on physicians' input into what products we choose from an environmental standpoint. But now as a surgeon, I'm talking about what products I use and what I don't necessarily need to use in the operating room. So a lot of the changes that have occurred in the Northwest under the SPOT umbrella have to do with physicians making impactful choices and being very planful in the operating room. So SPOT is, or Wait, Don't Waste, is really aimed at a very focused, immediately actionable impact on the waste stream. To address all of those things, of all the scope 1, 2, and 3 emissions, it requires a lot of big systematic changes that involve people, processes, tools, and technology. And if we wait for all of those things to be in place, we'll be waiting a very long time. It's kind of paralyzing, right?
Mm-hmm.
But we can make an impact now by getting people to think before they use something. And that's where the Wait, Don't Waste comes in. Wait a minute, think about what you're opening, and think about whether or not you really need it before you open it. Mm-hmm. We're focused, Wait, Don't Waste is focused on preventable waste. A lot of waste is not preventable. You drop something on the floor, now it's no longer sterile. You have to throw it away. That was not, well, you could argue that it was preventable because you didn't have to drop it, but it's still, you had to throw it away, right? But what kills me, one of those things that makes me die inside a little bit, is when stuff gets opened at the beginning of a case and then it just sits on the table and nobody ever uses it. And at the end of the case, maybe someone raises their hand and says, oh, how come we didn't use this? And the surgeon says, well, I never intended to use that. I don't know why you opened it. We shouldn't have opened it, right? Wait, think about it. Don't waste it. And that may seem like a very small change, but we have done a couple of projects in the Northwest already where we have been very thoughtful about what we open in the operating room. For instance, in 2019, we did a project where we made some changes in the packs that we use to provide all the basin materials and stuff that we use in the operating room. We eliminated 3 plastic items from those packs that we found were hardly ever being used. Because we use about 27,000 of those packs a year, we ended up eliminating about 5 tons of plastic waste and about 14 metric tons of scope 3 emission calculated, right? And that's a big success from a small change, and it's a proactive choice. Don't open it if you don't need it. Don't include it if you don't need it. There was also a study that was done out of UCSF where they just for 1 month tracked one department, neurosurgery. They tracked 58 of their procedures for a month, and they just tracked what got opened and thrown away unused because it wasn't necessary. And it came out to almost $1,000 a case worth of materials. It came out to about $250,000 a month worth of materials. And if you extrapolate that over a year for one service, one specialty, that's $2.5 to $3 million a year. Now, that's savings, that's money, but it also converts to volume of trash. That stuff all went in the bin, clean, unused, and got thrown away. And it could have been avoided by waiting and thinking about it before it got opened.
That's awesome. It sounds like a phenomenal program with a lot of great success. It sounds like there's some kind of systems pieces to that as well too, and thinking about how things are packaged as well too. It kind of reminds me. I'm going to be showing my age a little bit here with this comment, but it reminds me. Think about that, like think global, act local, sort of catchphrase that I think it was in the late 80s or early 90s that when we start thinking about pollution and the environment as well. What obviously, as we mentioned already, the healthcare system creates a huge amount of medical waste in general, and I think the Wait, Don't Waste is a great example of that. What kind of other comments or other kind of actions can physicians do to kind of impact climate and waste and trash and emissions and all the various different ramifications in using products?
It's partly in using products and being thoughtful and thoughtful in your choices and understanding what the options are and understanding what the impacts are of a given choice. But it's also in providing input into what products we want to bring into our system as a whole. One of the ways that products get introduced into our system is new innovations happening all the time. Mm-hmm. Physicians go to their professional society meetings and they see new products, new technologies, and they sound like a really good idea. They all sound like really good ideas because they all have really good marketers behind them. Right. I just saw one in my inbox in the email today, and it's about a disposable laryngoscope. Okay. Mm-hmm. And it's all pitched with pretty pictures, and it's all about convenience and how much cheaper it is per scope to use this. Mm-hmm. But what they don't talk to you about is you can only use it one time. It's battery powered. The battery goes in the trash. The plastic goes in the trash. If you were to try to reprocess it, it costs time, money, and petroleum to reprocess it. And so as a physician, I look at that, I'm like, oh, I'm going to go to my regional product council and I'm going to let them know that we should be using these disposable scopes. It'd be so much better. But I haven't personally taken a moment to step back and think about what that choice might mean. So it's I can be a driver as a physician. I can drive my organization to use certain things because let's face it, as the clinicians, we have a lot of power in that arena. And so I want to be thoughtful about what I ask for. I want to be thoughtful about what I use. And I want to be thoughtful about always considering, can I do the same good quality job and not use this device? Can I limit the amount that I use this device? Mm-hmm. Can I wait? Can I not waste? Right.
That's great. I love that too. And one of the questions that you kind of already just addressed this is, how can this work be scaled across our organization? And are there toolkits? Are there things available? I imagine from sort of a national level to an area level, there's different initiatives within this work too. Mm-hmm. So how can different physicians just learn more about what's happening at their local medical center and their local organization?
Yeah, so every local medical center has a local product council, and every region has a regional product council, and the members of those product councils are very well versed in the local initiatives that are occurring around this. Southern California, for instance, has their product utilization action team. Northern California has a group called SIST. And they all do similar work. The local product councils, the regional product councils are good places to get information. The National Product Council has a website, and on the website is listed a roster of all the surgeons or all the clinicians from all of the regions who are involved. If you have specific questions around your own specialty, you can reach out to those folks. You can reach out to me specifically if you like. I field questions from multiple regions all the time. And the link to all of those, the NPC resources are on my email address, my signature. So.
Awesome. And for physicians outside of Kaiser Permanente who may be watching this as well, I'm sure there's local councils at your hospital as well too. Mm-hmm. So you may just do a little investigation and asking around.
Yeah.
I have always have there's always like one or two people that we know that just know everybody and know everything about the workings of whatever your organization may be. And I always go to them and be like, hey, who do I talk to about this and that? And you name it. So you have to get a little creative.
It's interesting that you mentioned that about other organizations outside of Kaiser. In the Northwest, in the Portland metro area, we have a number of competing healthcare organizations, and we say competing, but really, especially through COVID, we've really been partners in a lot of things up here recently. And I think environmental stewardship is one of those things. One of our community healthcare systems. And I'm not sure if I'm supposed to say names or not, but some of our surgeons do, and our clinicians do go and outsource. We use them as an outsource provider. And we've had conversations with them about the Wait, Don't Waste work that the SPOT team is doing. They're very interested in it. They want to learn about it. And so I think to your point about what else can physicians do, they can spread the word about the work that we're doing in in Kaiser Permanente, Northwest Permanente Medical Group, in their interactions with outside providers. and be willing to share learnings and really sort of beat the drum for the work.
That's fantastic. Awesome. And there's a question in Facebook here. Based on different hospital systems, is there almost like some competing pressure to make sure you're being good stewards of our products and good environmental stewards as well? And how do some of Kaiser Permanente's efforts compare to other organizations, either locally or nationally? I'm not sure if you know that or not.
So I'm not sure if I can comment on a direct comparison. I do know that environmental stewardship, along with a lot of our equity goals, is definitely a portion of the business model for, I have to believe, every healthcare organization in our country right now. Do we compete directly? I think that it's hard to gain the kind of visibility you need into the true metrics that each organization is generating to create an apples to apples playing field and competition. I like to think of it not as a competition. I like to think of it as a shared partnership. This is a goal we are all working towards. If you're doing it better than us, any healthcare system, if you're doing it better than Permanente, Kaiser Permanente, then tell us how, because we want to do it that way too. If you think that we're doing it well, come talk to us. We're happy to share with you how we're doing it. It's not about who wins this one. We all win when we do it together and we do it well.
Yeah, that's such a great piece. You kind of already addressed a lot of my other questions, and one of my questions was, what specifically can physicians start doing today or tomorrow to help mitigate, environmental waste and medical waste? You've already sort of answered a lot of that already, but just kind of being aware of what your products are, talking to your local organizations about how we can reduce waste in products. And if you find something you're using or not using over and over again, let someone know about it so that you can kind of examine it from a systems point of view too.
Yeah. And I would speak specifically to the operating room. So for all of you surgeons out there, we have a phrase we use in the Northwest called surgeon as a leader. Okay. And I would encourage you to be the environmental leaders in your own operating room. That's where you are really the most in charge, is when you're standing in that operating room leading that team. Make sure you're paying attention to what your team is opening for you. Make sure you point it out. If you see them with a package that they're about to open and that's something you may not use, say, please hold it. Look at your procedure cards. Make sure that the things you don't use frequently are marked as to be held. And at the end of the case, one of the points here is you can't track what you don't measure, right? Or you can't measure what you don't track. And so there are ways that we record waste in the operating room. We actually track the things that are opened and unused, but that data is only as accurate as the record of what happened in the operating room. And so during your post-operative briefing, I would advocate for including your waste in the briefing. Hey, today we opened 3 things that we didn't use. Are they recorded? Yes. And can we change them to held for the next time we do this case? So and it won't happen if you, as the surgeon, as the physician leader in the room, don't lead and open the conversation. People are very busy, but if you really bring attention to it, it makes a difference.
Awesome. This is fantastic. As with all of our chats, I feel like we could go on and on and on, but I think we should probably wrap up for time's sake. So last question, real quickly, tell me what makes you most proud to be a Permanente physician.
I think there's so many things that I am proud of as far as being a Permanente physician, but I think the thing that makes me the proudest and the thing that has kept me with Permanente for 20 plus years is that I belong to a group of like-minded people who all want to and are committed to doing the right thing. That's doing the right thing by our patients. It's doing the right thing behind being stewards of our resources. And it's about doing the right thing for the environment. And I feel like I live and work with a group of people who really are committed to that.
Awesome. Wonderful. Well, thank you so much, Dr. Irwin, for joining us. Thank you for the work you're doing also in helping share this with all of us on within KP, but also within social media land as well, as I like to call it. So our next Permanente Docs Chat will be Thursday, May 5th at 11:30 Pacific, where that's Nurses Week. And we're going to be talking with some of our Colorado Permanente nursing leaders about nursing in the field of nursing as well. So make sure you tune in for that one in a couple weeks. Thank you all so much.
Thank you.